Hey guys, Simba here. I'm going to show you a few exercises I think everybody should do if they have any knee arthritis, especially ankylosing spondylitis and rheumatoid arthritis. First one is called a knee washing exercise. You want to put your hands just above your knee and start to draw these very small circles, just bringing in some movement, some blood flow, and some oxygen into the knees. Try to make the circles small to start with and very smooth. And you want the feet to be quite active. So the feet are actually moving along with this circle. And once you've done 10 or 15 on one side, do 10 or 15 on the other side. And you could do about 3 sets of this almost every day. But you want to go very gentle and make sure that you don't go into any painful bits. So don't inflame or aggravate anything. If anything, you can even bring it back even smaller circles just to start off. And then eventually, as you get comfortable, you start to grow the circle and start to increase the foot engagement. And once that feels really good, you can even go for the full depth. And it doesn't matter if your knees click or snap, it's okay, as long as you're in no pain. And you can go the other way as well. But you don't have to go to the full depth at all. That's exercise number 1. Exercise number 2 is called a ski squat. So your feet want to be quite close together and you're imagining you're skiing. So you want to push your knees to one side and you want to lean your body to the other side. And then lean to one side with my hands on my knees. This is just going to build a little bit of strength and stability through the knee, through the feet. And once again, we do about 20 reps of these with the feet engaged. And this is going to help so much with removing some of the inflammation by building some of the stability and strength back in the legs and in the knees. And body craves different movement variability, and it's one of the ways to overcome inflammation in any part of the body is to move it in different ways and strengthen it and mobilize it. So once you've done 20, you can have a rest. So the third exercise is called the single leg cycle. So you're going to try to balance on one leg and then just very gently cycle this leg as smooth as you can. You're going to aim for 20 reps. If you need something to hold on to, you can hold on to a chair here, but you want to be quite gentle, just cycling the knee. So you're building stability on one leg, and you're also building up some nice relaxed movement on the other leg. And once you've done this for 20 reps, you can go to the other side, you can hold onto a chair, find this balance in this other leg, and go into this single leg cycle, nice and gentle. The aim of this cycling leg is relaxedness. You want to be as relaxed as you can. So much of the time we hold so much tension in the body, we want to let that go and be as relaxed as we can. Once you've hit 20, you've done this one, and you can probably do this every second day and do 2 sets of that. The 4th exercise is a single leg shake. So you want to balance on one leg, you can hold onto a chair, and you just want to shake out the leg as much as you can. You're going to try to shake the foot from left to right and just try to get some relaxedness. This is going to help soften some of the really dried and calcified fibers and tissue in the leg. So just trying to shake that leg out independently from the rest of the body. So just trying to shake it. And then switching over, you're trying to shake it as much as you can, independently from the rest. And I would suggest maybe about 30 seconds of shaking on each leg. Maybe you can do 2 sets. Once again, you can hold onto a chair if you need to, or if you want to test and work some of the balance, which is also really good, which would be like level 2, you don't need a chair. And we're just trying to shake as much as we can and get so much more relaxedness in the leg. Right now, this leg isn't very relaxed. That's why it's not shaking very well. There we go. It's starting to shake better. Now, it takes a little bit of time for your body to drop into a space where it can feel really relaxed and the shakes kind of get much easier. It's a good way of testing whether you're holding on to a lot of tension in your body. So there you have it. There are 4 exercises that are going to help so much with your mobility and moving inflammation from the joint if you have ankylosing spondylitis, rheumatoid arthritis, or any other type of chronic joint issue. This is going to help so much, helped me so much on my journey of completely recovering my body back after being diagnosed with ankylosing spondylitis about 10 years ago. Stay tuned, and we'll be putting up way more tutorials for you guys to heal, recover, and feel incredible. Simba.